continuing from the last section, so failure to thrive is a catch-all term for any time of growth failure in a young child. So what we know is the cause may be congenital condition, disease, poor nutrition, neglect, abuse, or psychosocial problems. Treatments are usually an individualized plan that includes adequate nutrition and careful monitoring by physicians, dietitians, social workers, and other healthcare professionals. Undernutrition during infancy, so that's that first year of life, can permanently affect growth and development as well as health or later in life for a child. And because the first year of life is a critical period for brain development, undernutrition interferes with learning and affects behavior. Undernutrition in childhood is also a risk factor for diabetes, high blood pressure, and cardiovascular disease in adulthood, especially in the undernourished children who experience the rapid weight gain after infancy. So, what are the energy and nutrient needs of infants? Well, we know it's a rapidly growing time, and they have increased needs for energy, protein, vitamins, and minerals for growth. And human milk and commercially produced formula are designed to meet infants' nutrient needs. And infants, though, may still be at risk for iron, vitamin D, and vitamin K deficiencies, and for suboptimal levels of fluoride. So energy recommendations for 3 age groups are 0 to 3 months, 4 to 6 months, and 7 to 12 months. Nutrient recommendations for 2 age groups, the 0 to 6 and 7 to 12 months. So energy is different than the nutrients. But we do know that they all require an energy-dense diet in the first 6 months. They have a higher fat content in their breast milk and commercially prepared formulas. In the second 6 months, about 40% of their energy is fat. And these percentages are far higher, you can see, than the 20 to 35% of energy from fat recommended in adults. And the reason for that is the infants' needs for essential fatty acids are part of growth and development for cell structure and nerve development and that sort of thing. Infant macronutrient needs. This is a diagram that shows the amount of energy and the distribution of the energy yielding nutrients required by infants, and you can see strikingly different. That's what is recommended for the adult diet. So it's important for adults to know that children's macronutrient needs are different. They shouldn't be giving them low-fat things because their fat requirements are higher as long as they're healthy fats. So what you can see is, although the proportion of calories from protein is small, they require almost twice as much protein per kilogram of body weight than an adult. Same with dietary fat. Infants need some sufficient amounts of omega-3 fatty acid, DHA, and omega-6 fatty acid, ARA, because they're part of the cell membranes and development of the eyes and the nervous system. Infant calorie needs, the total amount of energy required by a newborn is less than the amount needed by an adult. But when this is expressed in calories per kilogram of body weight, we can see that infants require about 3 times more energy than an adult male. Water and iron needs. Water, they need to consume more water per unit of body weight than do adults. But remember that healthy infants who are exclusively breastfed do not need that additional water requirement. Iron, we can see that formula-fed infants should be fed iron-fortified cereal. Iron is the nutrient that's most commonly deficient in infants who are consuming even adequate energy and protein. It's usually not a problem in the first 6 months of life because the infants have iron stores at birth, and the iron in human milk, though not a lot, is really well absorbed. Formula-fed infants, usually they add iron to those formulas. Breast milk, let's talk about vitamin D. We know that breast milk is low in vitamin D, so often breastfed infants who don't get a lot of sun exposure, and most infants don't, are supplemented with vitamin D. And once they're able to consume dairy, vitamin D fortified milk daily. Vitamin K, all newborn infants are given a vitamin K injection at birth to help with those stores because they are at risk of vitamin K deficiency because very little vitamin K crosses the placenta, and the infant's gut is sterile, so there's no bacteria to synthesize this vitamin. And we know that vitamin K deficiency can cause bleeding, so they get this intramuscular injection, usually at birth, which provides enough of the vitamin to last until their intestines are colonized with the natural bacteria that synthesize it. And they don't really talk here about fluoride, but we know that fluoride is important for tooth development, even before the teeth erupt, and breast milk is low in fluoride, and formula manufacturers use unfluoridated water in preparing the pre-prepared liquid formulas, so oftentimes fluoride may be included in a multivitamin supplement for infants. So breastfeeding, recommendations for newborns of healthy, well-nourished mothers. U.S. health professionals recommend breastfeeding for at least 1 year, exclusive breastfeeding for 6 months, and breastfeeding with complementary foods for at least 1 year, as long thereafter as mutually desired, and lactation can continue as long as suckling is maintained. And here we can see the do's and don'ts of bottle feeding. And what this picture shows on the left is during bottle feeding that infant's head and shoulders should be higher than his or her stomach, and the bottle should be tilted so there's no air in the nipple. So just like breastfed infants alternate breasts, bottle-fed infants should be held alternately on the left side and the right side to promote equal development of the head and the neck muscles. We know that infants should never be put to bed with a bottle because saliva flow decreases during sleep and the formula remains in contact with the teeth for many hours, and this can cause nursing bottle syndrome, which is a terrible, rapid, and serious decay of the upper teeth. Usually the lower teeth are protected by the tongue, but you can see the rotten teeth there in this infant. Breast milk, a lot to know on breast milk. I could really teach a whole course on breast milk, so we're really just hitting the highlights here. Colostrum is produced by the breast for about a week after delivery. We know that it has beneficial effects on the gastrointestinal tract. It acts as a laxative that helps the baby excrete the thick, mucousy stool produced during life in the womb. We know the nutrients in breast milk supply meet the infant's needs until mature milk production begins. So the colostrum is very nutritious and contains more water, protein, immune factors, minerals, and vitamins, and less fat than mature milk. Colostrum is the first milk produced by the breast and late in pregnancy and for about a week after the baby is delivered. And compared to mature milk, it's more water, protein, and all of the good things that are in it. Mature breast milk contains an appropriate balance of nutrients and an easily digested format. Infant formulas try to replicate human milk as closely as possible in order to match the growth, nutrient and absorption, and other benefits associated with breastfeeding. So, pros and cons, breast milk versus formula. I really want you to read through this in this week's discussion forum. So, I want you to answer this question for me. What are the comparisons? What are the differences? What are the benefits of mothers and children? So, I'm going to give you the highlights here. The benefits of breast milk is that formula can never exactly duplicate human milk composition because it's ever changing. Cells and antibodies and other substances pass to the child, providing immune protection. We know that growth factors and hormones promote maturation of the infant's gut and immune defenses and enhance digestion. And there are many physical, emotional, and financial advantages for the mother and for the infant. So benefits for infants, optimal nutrition, bonding, immune protection, reduces allergies, decreases in ear infections, respiratory illness and asthma, reduces the likelihood of constipation, diarrhea, or digestive disorders, reduces the risk of SIDS, lowers the risk for obesity, type 1 and 2 diabetes, heart disease, hypertension, high cholesterol, and childhood leukemia. It aids in the development of facial muscles, speech development, and correct formation of the teeth, and it lessens the risk of overfeeding because the amount of milk consumed cannot be monitored visually. When is formula better? Well, certainly there are times when it's necessary, and when some substances can be passed to a baby in breast milk, tuberculosis, bacterium, HIV, nicotine, some medications, alcohol, cocaine, or marijuana, things that will pass from the mother through the breast milk that can cause irreversible damage to the baby. It does allow family members to share in the responsibility, and there are special formulas available for preterm infants or those with genetic abnormalities. So can you drink alcohol while you're breastfeeding? Alcoholic mothers are counseled not to breastfeed because it can pass through to the infant. Occasional limited alcohol is probably not harmful, is if alcohol intake is timed to minimize the amount present in the milk when the infant is fed. After consuming one alcoholic drink, you need to wait at least 4 hours before breastfeeding. Alternatively, milk can be expressed before consuming the drink and fed to the infant later. If you're stockpiling your milk, you can pump out some of that alcohol from the breast milk. Safe feeding for the first year. So let's talk about that. So whether infants are breastfed or formula fed, care must be taken to ensure that their needs are met and their food is safe. That includes proper measuring of formula. The infant can receive an excess or a deficiency of nutrients. If you're not measuring it and you're trying to spread your formula to last longer, it's not a good idea. You need safe, clean water for preparing formula. If formula is left unrefrigerated or even breast milk, foodborne illness can result. Sometimes sanitation can be lacking in developing nations and even in our own nation, and some infections of this unsafe preparation of formula can lead to diarrhea and dehydration, but it does typically occur more frequently in formula-fed infants than in breastfed infants. We know that typically bacterial contamination is not a concern when a baby is breastfed, but we do need to take care of making sure that if we're pumping breast milk and it's stored for later, that hands, breast pump bottles, and nipples are all washed. Breast milk that is not immediately fed to the baby can be kept refrigerated for 24 to 48 hours. We don't recommend warming breast milk in a microwave.